speak to a nurse who happens to be one of our MPs, the MP for Lewis, Maria Caulfield, on the line. Hi, Maria. Good morning to you.
Good morning.
What do you think is causing this pressure on beds right now?
I mean, this has been a particularly bad winter, but we have faced similar pressures in the past. I mean, I know when I worked in A&E, in one of the hospitals that you mentioned, St Helier, we had to declare major incidences when we just could not take any more patients. And I've also worked more recently at the Royal Sussex County in Brighton, where, one of my jobs as a Macmillan nurse was having to tell patients on a Monday morning they wouldn't be getting their operation because beds had been occupied over the weekend with emergencies. And you cannot underestimate the stress that puts under staff to, you go into nursing or any healthcare profession to make a difference and to improve the lives of patients, and to be working under such negative conditions, really does take its toll.
You mentioned, Maria, about a bad winter. Really? Has it been? I mean, we haven't had a seriously cold snap. I mean, there's one on the way in the next couple of weeks, but it hasn't been consistently very cold. So what do you mean by a bad winter?
So, although it hasn't been cold, there has been a huge spike in a number of people being admitted with respiratory illnesses and, with viruses as well, which has put on a huge pressure, not just on A&E, but on the actual beds itself. So when people are being admitted, they're being admitted for many weeks on end, and so there then becomes a knock-on effect back to A&E when new patients need to be admitted. And as a result, new beds, community beds have been opened up in Newhaven, in the community hospital there, to try and take some of the pressure off the nearby District General Hospital. So, it is a bad winter. Although it's not a cold winter, there has been an increase in the number of patients using both A&E and also being admitted.
I see, but I mean, quite clearly in the first episode of Hospital, I mean, you're very busy, Maria, so I'm not sure you'd have got a chance to watch it, but there was this absolute dilemma. There was a guy scheduled in for the second attempt at his cancer operations. That's a scheduled operation. But then you've got this lady coming down who's got a heart aneurysm from Norfolk, I think it was, in an ambulance. And they both need an acute bed after they come out of their operations. There's only one bed, only one of them can get them. So the whole team waiting for the cancer operation gets delayed for the day, and in the end they do no work, the operation gets cancelled, and the patient's sent home again. So what's the solution to a situation like that?
I mean, it's a very difficult situation, and it's not a new situation. Health professionals, especially with ITU beds, there's been a shortage for many, many years, and it does make it a very challenging job and stressful for staff, but also for the patients. I looked after patients who had their operations cancelled 2 or 3 times before they eventually got it, and the psychological distress for those patients is immense at a time which is a difficult time anyway. And there isn't a quick fix to this. So solutions like increasing the community beds in Newhaven, for example, will allow some patients who are fit for discharge but are not yet quite fit to go home, or their community care package hasn't been set up yet, can be discharged and free up some of those beds. But there isn't a quick fix, a one solution that's going to magically cure the problems of the NHS and social care overnight.
And the chief of the Sussex and Surrey NHS Trust, Michael Wilson, was saying about elderly and frail people being in hospital when they don't need to be, more people being in hospital with mental health issues. Again, they're in district general hospitals where they can be perhaps looked after best elsewhere. So what do we do about them?
Well, there is plans to bring health and social care together, and this has been something that's never really happened before. We've talked a lot about it, because while healthcare has been getting more funding in terms of the NHS, social care hasn't. It's seen a drastic drop, and that's put extra pressure on the health service, because if you don't have people to support people in their own homes, whether they've got mental health problems or physical problems, then ultimately the NHS ends up having to look after them. So there is extra funding now going into social care, but also more crucially, there's plans to join health and social care together so that it isn't seen as a separate service, that health care professionals and social care professionals will be working together to jointly deliver care. But that's going to take time for people to see that difference, and meanwhile the NHS services are having to carry the load.
Maria, finally, if and when your time as the MP for Lewis comes to an end, do you go back to nursing full-time?
Yeah, absolutely. I mean, I still do my shifts in the hospital on the bank, so I'm a bank nurse at the moment, but absolutely, it's as rewarding a job as an MP is. You don't get the same reward as you do as a nurse. You really do make a difference. You're paid much less, but you do get a huge amount of satisfaction from doing that job. So I would encourage anyone who's thinking about doing nursing to do it, because it's a fantastic job.
And some return